Are you wondering whether you're doing your pelvic floor exercises correctly or not? Hi, my name's Michelle and I'm a pelvic health physiotherapist. I work with men and have worked with men for 25 years. What men commonly ask me when they come to see me is, Michelle, am I doing my pelvic floor exercises correctly? How do I know? Men are often sent away for erectile dysfunction problems or for bladder control problems with bladder leakage, perhaps after prostate surgery, advised to do Kegel exercise, but not shown how to do them. And let's face it, whoever teaches us how to do pelvic floor exercises until we really need to know about them when we're experiencing problems. Today, I'm going to guide you through how to know whether you're doing your pelvic floor exercises correctly or not, what you should feel with correct pelvic floor exercises, what you can expect to see when you're doing correct pelvic floor exercises, and then I'll show you a really quick fix, the quickest fix I know to help you activate your pelvic floor muscles correctly. And then finally, I'm going to guide you through how to know whether your Kegel exercises or pelvic floor exercises are progressing over the coming weeks and months. Let's start now with what you can expect to feel with a correct pelvic floor exercise. Remembering from the evidence in my previous videos that a correct pelvic floor exercise for bladder control, for erectile dysfunction, involves a certain cue. And we use this cue because it has been shown in the evidence as the best instruction for men to activate these pelvic floor muscles. And the muscles we're activating are muscles at the front of the pelvic floor. These are muscles that are deep to the base of your penis, where your penis attaches to your body. The correct action and the correct cue is to shorten the penis. Shortening the penis means to retract or move the penis inwards towards your body, just very subtly and very gently, and then release and let go. When the pelvic floor muscles contract, the penis moves slightly inwards and slightly upwards to the belly. And then when the muscles relax, which is equally as important with pelvic floor exercises, the penis moves back to its resting position. Now, what can you expect to feel when you're doing these exercises correctly? There's two things. What you can expect to feel is a very gentle tightening around the base of the penis, and that means that area where the penis attaches to the body. Just a really gentle tightening and then a letting go sensation. You might also like to feel using your index and third fingers, and you can apply those fingers just gently against the area of skin between the testicles and the anus, and that area of skin is known as the perineum. When you do your pelvic floor exercises correctly and contract the correct pelvic floor muscles, what you'll feel against your fingers is a subtle firming of that area of skin called the perineum. You might feel that at first and you might not, and that's okay. I'm going to be going through some more cues to help you know in just a moment. So there's two things you might feel. You might feel that tightening around the base of the penis. You might feel that firming of the perineum, and remembering it's going to be very subtle when you first start out. Let's talk now about what you might expect to see with the correct pelvic floor exercises. When you do correct pelvic floor exercises, what you can expect to see is a very subtle shortening of the penis, inward movement of the penis towards your body, and a slight upward movement of the penis towards your belly. And then you'll see it release and return back to regular position as you relax the pelvic floor muscles. So there are two key things to notice: the feeling and the visible movement. If you're still having difficulty with this, here's the quickest fix that I know, and it's a great fix to help you. What you can do to know that you're doing your pelvic floor exercises correctly and help activate these muscles is to use your thumb and your first two fingers. Take the fingers and apply them to the end of the penis. Now, just apply a very gentle lengthening action, not a stretch, just a very gentle lengthening with those three fingers. The muscles responsible for that movement are the muscles that help control the bladder and are also involved in a coordinated manner in helping with erectile dysfunction. And then try the exercise without the resistance and see if you can replicate that same feeling again. These are three of the most common problems that men experience and tell me about and ask me about. How do I relax my belly? How do I breathe normally? And how do I keep my buttocks relaxed? What you can do is to use less effort and start with really gentle contractions. As I've already stated, it's very important just to start with a really gentle muscle activation where We're just trying to switch these muscles on at the outset. We're not trying to strengthen them. We're not trying to get a whole lot of endurance in there. We're just trying to develop the mind-muscle connection to get those muscles working correctly. This is key, and this is what you need to know from the outset to get success with your pelvic floor exercises. If you hold your breath during exercises, that puts a pressure down on the pelvic floor, and it can make bladder problems worse. We want you to be able to just breathe normally as you shorten the penis and then relax. Very important that your tummy muscles stay mostly relaxed, particularly the upper tummy muscles, those six-pack muscles, that they're not drawing in, because those too create a pressure down on the pelvic floor and make pelvic floor exercises more difficult. Finally, keeping your buttocks relaxed and your thighs relaxed for that matter can help, because if they're contracting, that can make you feel that you're doing your pelvic floor exercises when actually you're not. And one of the ways to overcome that, aside from activating very gently, is to make sure that you're in a supported position to start with your legs comfortably extended out in front of you and your upper body comfortably supported. How can you know that your pelvic floor exercises are actually working and making a difference over the coming weeks and months? Well, the first thing you can do is do a flow stop test. And that means when you're peeing or urinating, you can try to slow the flow or stop the flow of urine using the exercise that I just described. Now, you do this as a test only, and you might find, or you might notice, that you can actually slow the flow or stop the flow altogether, perhaps when the stream is just a trickle at first, or as the stream becomes stronger. This is a sign that your pelvic floor muscles are actually getting stronger, but you do this as a test only, not as a regular exercise. You might also notice increasing firmness and hardness in the penis with erections, and you might start to notice nighttime erections as well. The other positive sign that your pelvic floor strength is improving is that you can actually hold your pelvic floor exercises a little bit stronger, but first of all, for longer periods of time or longer duration. These are all signs that your pelvic floor exercises are working, and it is very important to gradually increase how long you hold your pelvic floor exercises for, up to 10 seconds, and also to how strongly you contract them over time, making sure that you always stick with the correct exercise that we've already spoken about. If you have questions or comments about the techniques that I've gone through today, really welcome them. I really hope these tips help you know that you are doing your pelvic floor exercises correctly and guide you towards improving the strength and control of your pelvic floor muscles. Thanks so much for watching today. I'll look forward to seeing you in the next video. Goodbye for now.